You know, our skin is like a map. It often tells us what's going on beneath the surface, especially as we get older. Have you ever noticed a new patch of discoloration, a sudden rash, or a mole that just doesn't look right? Maybe you brushed it off thinking, oh, it's just age. But what if I told you your skin might be trying to send you a message, one that could reveal something important about your overall health? After 55, our bodies change in ways we don't always see right away. But the skin, it's right there in plain sight. And sometimes it gives us early warnings about internal health issues we shouldn't ignore. Today, we're going to talk about 6 key warning signs on the skin that could signal something deeper. Things like diabetes, heart problems, or even vitamin deficiencies. The good news? Catching these signs early can make all the difference. Let's start with the first one, something you might not think much about. Unexplained bruising. Now, a bruise here and there is normal, especially if you bumped into something. But if you're noticing bruises appearing out of nowhere, no memory of bumping into anything, that could be a red flag. As we age, our skin gets thinner and our blood vessels become more fragile, which can lead to easier bruising. But sometimes, frequent bruising can point to something more, like low platelet counts, blood clotting issues, or even liver problems. If you're seeing a lot of bruises without an obvious cause, it might be worth mentioning to your doctor. Another sign to watch for is yellowish patches or bumps around your eyelids or joints. These might look like small, soft deposits of fat, and while they're not painful, they could be telling you something about your cholesterol. These patches, called xanthelasma, often appear when cholesterol levels are high. High cholesterol doesn't usually come with obvious symptoms, which is why these little skin changes can be such an important clue. Left unchecked, high cholesterol can lead to serious heart issues. So if you spot these yellowish patches, a simple blood test can give you answers. Now let's talk about dry, itchy skin. Sure, dry skin is common as we age. Our skin produces less oil and the air can get drier, especially in winter. But if your skin stays dry no matter how much lotion you use, or if the itchiness is intense and widespread, it might be more than just dryness. Conditions like diabetes or kidney disease can cause persistent itching because they affect circulation and toxin removal in the body. Even an underactive thyroid can lead to dry, flaky skin. If moisturizers aren't helping, it's worth asking your doctor if there's an underlying cause. These are just the first few signs, but they're important ones. Our skin is often the first place our body waves a little flag saying, hey, pay attention here. And the sooner we do, the better we can take care of ourselves. Now let's move on to another key warning sign. Something you might notice in the mirror every day but not realize could be connected to your health. You've probably looked in the mirror and noticed changes in your skin over the years. Some subtle, some more noticeable. But what if I told you that some of those changes could be whispering important clues about your internal health? Let's keep exploring these skin signals so you know exactly what to watch for. Take dark velvety patches on your neck, armpits, or groin, for example. These patches might feel slightly thicker than the surrounding skin and can sometimes appear brown or grayish. This condition, called acanthosis nigricans, isn't just a cosmetic issue. It's often linked to insulin resistance, which is a hallmark of type 2 diabetes. If you've noticed these patches, especially if they've developed gradually, it's a good idea to get your blood sugar levels checked. The earlier you catch insulin resistance, the more you can manage it through diet, exercise, and, if needed, medication. Now let's talk about persistent redness or a butterfly-shaped rash across the cheeks and nose. This one might look like a sunburn at first, but if it doesn't fade and seems to flare up, it could be a sign of lupus, an autoimmune disease where the body mistakenly attacks its own tissues. Lupus can affect more than just the skin. It can impact joints, kidneys, and even the heart. Of course, not every flushed face means lupus. Hot flashes and rosacea can cause redness too. But if the rash is stubborn and comes with fatigue or joint pain, it's worth discussing with your doctor. Another surprising skin clue: slow healing sores or wounds. As we age, cuts and scrapes might take a little longer to heal, but if you notice a sore that just won't close, especially on your feet or legs, it could signal poor circulation or diabetes. High blood sugar levels can damage blood vessels and nerves, slowing down the body's natural healing process. If you've had a sore lingering for weeks, don't brush it off as just part of getting older. Getting it checked early can prevent infections or more serious complications. These skin changes might seem small at first, but they're often our body's way of getting our attention. The key is to listen, because when we do, we can take steps to protect our health before small issues become bigger ones. Now, let's move on to the final signs, ones you might not expect to be connected to your skin at all. Our skin really is a remarkable messenger. It's always communicating with us if we know how to listen. And sometimes, the signs it shows can be the very first clue that something deeper needs our attention. Let's wrap up with the last few skin changes that could be signaling important health shifts after 55. Have you ever noticed small, reddish-purple spots that look like tiny bruises, but don't fade when you press on them? These are called petechiae, and while they can sometimes appear after a coughing fit or straining, they can also point to low platelet levels or even issues with blood clotting. Platelets help our blood clot properly, so if you're seeing these little dots pop up without an obvious reason, especially on your legs or inside your mouth, it's worth bringing up with your doctor. It could be something as simple as a vitamin deficiency, but it's always better to know for sure. Another sign to watch for is sudden, severe itching without a rash. Now, we all get itchy now and then, maybe from dry skin or a pesky mosquito bite. But if you're experiencing relentless itching all over your body, and there's no rash or dryness to explain it, it could be a sign of an internal condition like liver disease, kidney problems, or even certain cancers. The itching happens because toxins build up in the body when these organs aren't filtering properly. If lotions and antihistamines aren't helping, don't ignore it. A simple blood test can often uncover the root cause. Thickened, waxy skin on the hands or feet. If you've noticed your skin feeling unusually tight or waxy, almost like it's hardening, it could be a rare but serious condition called scleroderma, where the body produces too much collagen, causing skin and connective tissues to thicken. In some cases, this can also affect internal organs like the lungs or digestive tract. Now, this isn't common, but if you're seeing these changes along with symptoms like shortness of breath or difficulty swallowing, it's important to get evaluated. So, what's the takeaway from all this? Our skin isn't just covering us up, it's a window into our overall health. And while not every new spot or itch means something serious, being aware of these signs empowers us to take action early. The best thing you can do? Pay attention, notice changes, and don't hesitate to ask your doctor about anything that seems unusual. After all, the sooner we catch these clues, the better we can take care of ourselves and keep enjoying life to the fullest. If you found this helpful, I'd love to hear from you in the comments. Have you noticed any of these skin changes? What steps have you taken to address them? And if you're not already part of our community, hit that subscribe button and join us at Aging Gracefully 60 for more tips on thriving in your golden years. Remember, aging isn't about slowing down, it's about living well, staying informed, and taking charge of your health. Here's to your brightest, healthiest days ahead.